You just heard from Representative Pastor Gary Click is the author of the HB 68 in Ohio. So appreciative of him coming on and explaining what this is all about. And now we all sit and wait as Ohio Governor Mike DeWine is looking over this bill. He's, look, this is a bill that protects children in his state from harmful and permanent medical procedures that include mutilation and sterilization.
This is a very, very contentious issue. Other states have dealt with this issue as well. And ultimately, my decision will be based on one thing, and that is what I think is in the best interest of the children who would be impacted by this particular law.
Okay, we give Governor DeWine the benefit of the doubt, the belief when he says he wants to do that which is best for the children. Let's believe him and let's encourage him to make that best decision. And what I would like to do right now is play for you a congressional testimony that took place a couple of months ago. In fact, Representative Click referred to Chloe Cole just a few moments ago. She has been on Washington Watch several times, but she underwent these procedures when she was a child. She has experienced firsthand the havoc that is caused by these procedures when they are done to anyone, but particularly to young people. And she has challenged lawmakers and those who care about children, Governor DeWine, those who care about children, she has challenged them to do the right thing. And I want you to hear just a little bit, a couple of minutes, a few minutes of her testimony. And I certainly hope Governor DeWine hears this as well. So for the next few moments, listen to this powerful testimony. Here's Chloe.
My name is Chloe Cole, and I am a detransitioner. Another way to put that would be, I used to believe that I was born in the wrong body. And the adults in my life, whom I trusted, affirmed my belief, and this caused me lifelong, irreversible harm. I speak to you today as a victim of one of the biggest medical scandals in the history of the United States of America. I speak to you in the hope that you will have the courage to bring the scandal to an end and ensure that other vulnerable teenagers, children, and young adults don't go through what I went through. At the age of 12, I began to experience what my medical team would later diagnose as gender dysphoria. I was well into an early puberty, and I was very uncomfortable with the changes that were happening to my body. I was intimidated by male attention, and when I told my parents that I felt like a boy, in retrospect, all I meant was that I hated puberty, that I wanted this newfound sexual attention to go away, that I looked up to my brothers a little bit more than I did to my sisters. I came out as transgender in a letter I sent on the dining room table. My parents were immediately concerned. They felt like they needed to get outside help from medical professionals, but this proved to be a mistake. It immediately set our entire family down a path of ideologically motivated deceit and coercion. The gender specialist I was taken to see told my parents that I needed to be put on puberty-blocking drugs right away. They asked my parents a simple question: would you rather have a dead daughter or a living transgender son? The choice was enough for my parents to let their guard down, and in retrospect, I can't blame them. This was the moment that we all became victims of so-called gender-affirming care. I was fast-tracked onto puberty blockers and then testosterone. The resulting menopausal-like hot flashes made focusing on school impossible. I still get joint pains and weird pops in my back, but they were far worse when I was on the blockers. A month later, when I was 13, I had my first testosterone injection. It's caused permanent changes to my body. My voice will forever be deeper, my jawline sharper, my nose longer, my bone structure permanently masculinized, my Adam's apple more prominent, my fertility unknown. I look in the mirror sometimes and I feel like a monster. I had a double mastectomy at 15. They tested my amputated breast for cancer. And I was cancer-free, of course. I was perfectly healthy. There was nothing wrong with my still developing body or my breasts, other than that, as an insecure teenage girl, I felt awkward about it. After my breasts were taken away from me, the tissue was incinerated. Before I was able to legally drive, I had part I had a huge part of my future womanhood taken from me. I will never be able to breastfeed. I struggle to look at myself in the mirror at times. I still struggle to this day with sexual dysfunction. And I have massive scars across my chest. And the skin grafts that they took of my nipples are weeping fluid today. And they were grafted into a more masculine positioning, they said. After surgery, my grades in school plummeted. Everything that I went through did nothing to address my underlying mental health issues that I had. And my doctors, with their theories on gender, thought that all my problems would go away as soon as I was surgically transformed into something that vaguely resembled a boy. Their theories were wrong. The drugs and surgeries changed my body, but they did not and could not change the basic reality that I am and forever will be a female. When my specialist first told my parents that they could have a dead daughter or a live transgender son, I wasn't suicidal. I was a happy child who struggled because she was different. However, at 16, after my surgery, I did become suicidal. I'm doing better now, but my parents almost got the dead daughter promised to them by my doctors. My doctors had almost created the very nightmare they said they were trying to avoid. So what message do I want to bring to American teenagers and their families? I didn't need to be lied to. I needed compassion. I needed to be loved. I needed to be given therapy to help me work through my issues, not affirm to my delusion that by transforming into a boy, it would solve all my problems. We need to stop telling 12-year-olds that they were born wrong, that they are right to reject their own bodies and feel uncomfortable with their own skin. We need to stop telling children that puberty is an option, that they can choose what kind of puberty they will go through, just so they can choose what clothes to wear or what music to listen to. Puberty is a rite of passage to adulthood, not a disease to be mitigated. Today, I should be at home with my family celebrating my 19th birthday, and instead I'm making a desperate plea to my elected representatives. Learn the lessons from other medical scandals like the opioid crisis, to recognize that doctors are human too, and sometimes they are wrong. My childhood was ruined along with thousands of detransitioners that I know through our networks. This needs to stop. You alone can stop it. Enough children have already been victimized by this barbaric pseudoscience. Please let me be your final warning. Thank you.
Powerful, powerful words. Governor DeWine, I hope you hear these words. People in Ohio right now, I hope you hear these words. I want to continue this discussion. I'm honored to be joined now by Dr. Jennifer Bauwens. She's the director of the Center for Family Studies here at the Family Research Council. She also testified along with Chloe on Capitol Hill that day. Powerful, powerful day it was. Dr. Bauwens, thank you for joining us on Washington Watch. Thank you for being here.
It's good to be with you, Jody.
All right, I don't know that it gets any more profound than the testimony we just heard from Chloe. You were there, you sat right in the room, you testified yourself as a professional on this issue. Describe the atmosphere in the House hearing room after Chloe spoke.
You know, it's so powerful, the testimony that she gave, because she, in just a short time, she depicted the major issues that surround this issue. And that is the whole transgender ideology is a created concept. And it is, you know, they say that biological sex is a created concept. Well, if you follow that logic all the way through, you have to come back to, yes, and you created this idea of transgender too. And there is no objective test to test what you're proposing, that people are the opposite sex of what they are actually biologically endowed with. And I think what Chloe did was she highlighted that, you know, in the room, you could tell that the responses people were shaken, because there is no response to the objective reality of our biological sex. All of this other stuff is fantasy and conjecture and people making up concepts about our biological sex. And when you present the research and you actually begin to unpack it, there is no response. So, someone like myself, I didn't get any questions. They're not going to ask questions about what has been veiled on this topic for many years, and that's what they do. They've been using research to veil the truth about what is really going on behind the scenes of quote unquote gender affirming care. And here's someone like Chloe Cole, and unfortunately there are many other Chloe Coles who've been victimized by this ideology and by the practices that go along with it.
Well, and just by her testimony alone, that phrase, gender affirming care, it seems to me that Chloe totally shredded that concept with the treatment that she was really pushed into and her parents were forced to accept. It was anything but care. It was destructive. It destroyed her life. And what is genuine care is to help people, from her own testimony, to help people through those struggles that they're having. Now, you are an expert in trauma and the effects that trauma has on people. Talk about what you've learned from your experiences with detransitioners and the traumatic effects that these procedures have on them.
Yeah, I think the first thing we have to realize is that the whole presenting issue, by that I mean, if someone comes to a therapeutic setting and they're saying they're presenting with discomfort in their body, and they are immediately fast-tracked into this gender-affirming care pathway, what happens is, because of the counseling bans that are in so many states and because of the nature that surrounds the gender-affirming or the gender dysphoria idea, therapists don't explore. So kids immediately get fast-tracked onto this pathway, and their true issues aren't getting dealt with. And that's what Chloe Cole was bringing out in her testimony, is that she had other underlying conditions that were not being addressed by the therapist. They were being completely ignored. So right off the bat, we have a situation where kids are not getting therapy or treatment for their true issues. And now they have other complications that come from this so-called treatment. And those complications include physical damage to their body. Because if a kid goes onto puberty blockers and then onto the cross-sex hormones, it's almost a guaranteed sterility. And then on top of that, we can't forget about the psychological ramifications of, basically, we're parentifying children. Children weren't meant to be parents. That's why we call it child rearing, because they need leadership. They need an adult to be in the room that's going to protect them. And so when they're put in a position where they are making major life decisions that are going to affect the rest of their life, they're going to affect the rest of their physical life, their future sexual life, as well as their psychology, because something happens to the brain when you thwart it through puberty blockers. You put another sex's hormones into your system. Remember, you can't forget what it was like to go through puberty, and we called it hormonal for a reason. And now we're going to add the opposite sex hormones into our systems. Imagine what that's going to produce psychologically. And then, Jody, of course, there's spiritual harms to this, right? Because we have a whole group of people, maybe they're educators or even our parents, like Chloe's parents got sucked into this ideology in an attempt to help their child. And so when we have that, when that occurs, we're given family to reflect who God is and God's nature. And that impacts us spiritually as well, because are we going to believe in the future that God is really going to protect us? Or are we going to believe that we have to make all the decisions ourselves, that we have to be in charge, and that we don't have someone who's looking out for us and caring for us? So there are lots of ramifications, physically, emotionally, and spiritually, when it comes to the damage that comes from gender-affirming care.
And all of this, those of us like yourself and many others who try to stand in the gap are accused of denying these people of life-saving care. It's just unbelievable. Dr. Bauwens, our time is running out, and I want to get this last comment to you, and I want to put on the screen again the number to Governor DeWine's office that people can call in and give their input to him and encourage him to sign this bill. But in the last little bit that we have, how would you advise Governor Mike DeWine, if he sincerely wishes to protect children, what would you say to him?
I would say, if you really want to protect kids, first of all, recognize that you have research on your side. Anyone in any nation that has delved into the research that's been used to support these practices has come away saying it does not exist. This is not life-saving care. You cannot prove it from any scientific empirical standpoint. Second, you have psychology, developmental psychology on your side. We know, we have tons of studies that show development happens not until kids are 25.